Well, hello, everyone. Thank you for joining us. My name is Michael Hansen. I am one of the senior engineering manager here at Luma. And welcome to Digital Health on Air. Today, we're going to be diving a little bit into our data and the analysis. I am joined currently by Luma's lead data scientist, Lauren Toe, who is our lead data scientist and becoming engineering manager, as well as Jacob, who's our senior data scientist here at Luma Health. So really excited to kind of have this conversation with people that are way smarter than me and talking about data. So, Lauren, you kind of spearheaded data analysis into patient behavior and access patterns using tons and tons of data points over the course of multiple years. Can you kind of give a little bit of background of what prompted this analysis?
Sure. Michael's being humble, by the way, but in our work with health systems, we're always asked about what is the best practice that a medical organization can give to its patients. So we actually tried to find information from the viewpoint of how can a staff or how can a medical organization best help patients. But so that's kind of our quest, is just finding what kind of behavior can we do on our end that resonates best with patients, what helps them get to their appointment better, what makes their clinical care more of a pleasant experience. And so a lot of that interaction between staff and patients actually comes down to communication. It comes down to outreach. And that's really largely what we centered a lot of our analyses around.
Yeah, and that is super cool. And we know that communication is challenging, especially in the age where everything is a notification. You get pinged for everything. We've all put our phones on do not disturb during the workday. We've seen emails come through that we didn't really have time to respond to. So I was like, I'll just do it later. I was like, I don't want to pay attention. I'm too overwhelmed. We all had to time crunch with the small breaks we had between any type of work calls we've had. And that really often includes having to manage our care and family care, as something that is deprioritized, right? And I was like, I have too much to handle, and I don't know how to handle all these messages. We feel kind of really being inundated. And I'm personally feeling like it. I feel like every notification I get outside of a work email is just more work. And my family tend to be like, Michael, why you're not responding? Because you're in the backlog of all the messages I have to respond to. But we are responsible for managing our care. Lauren, if you can kind of give us a little bit of context of, how we feel like that can impact, from your perspective, the patient care and also, the staff on the other side.
It's a really tough balance, right? And I think that's why it ends up being such a challenge to try to model such diverse patient behavior with data. But that's also why so many solutions nowadays and so many folks who are in this communication and scheduling space, that's why they are really geared towards giving the patient as much flexibility as possible, so that, hey, maybe you don't have to make a phone call during your working hours between all your meetings and skip your lunch and whatnot. You can communicate with your health org anytime. You can schedule at any time. And really, you want if you are going to send communication to help a person manage their health and their family's health, you want that information and the communication to be as helpful as possible.
Yeah, and that makes total sense, right? We're really trying to optimize to kind of account for these overall. And I think we have a quote here that James Hereford, kind of president and CEO at Fairview, kind of summarized really the main issue that is really simply reaching out to patients. Obviously there's tons of places where we can optimize our flows and our processes, but the first point is really getting in touch with the patient, making sure that the patient is engaged, and really trying to remove that great, you've probably heard, it's become a little bit buzzwordy, that kind of great patient disconnect, right? What we've been talking after the first 5 minutes here. And so kind of given that challenge, given that context, Lauren and Jacob and the rest of the data team have been really trying to, find ways for our data to kind of optimize the way we can reach out to patients and manage that disconnects, bridge the gap here to bring your patient to communicate with your healthcare organization. And it's true that much of the feedback a healthcare organization gets is direct, right? That is obviously critical, right? I was like, if you happen to lead a healthcare organization and in the future, you would want to have that face-to-face interaction with the patient, getting the feedback, understand what they're saying, etc. But what we wondered if we could get some good insight from seeing how the patient actually interact and engage from the part they can tell you one thing, but they actually do something else, right? And here is where I want to bring Jacob onto the call. He's been crunching a lot of this data, bringing a lot of models to try and really understand. I was like, where are the gaps? Where are the opportunities here? And understand when they're responding. Is there correlation between what's in the message and what the next step they can take? And so, Jacob, can you tell us a little bit about kind of what has been your focus? What have you been diving in? What was kind of your process here to kind of bridge that gap?
Yeah, totally. Thanks, Michael. So just to start off, Luma being a HIPAA compliant company, we are obligated to collect quite a bit of data and house it. And that really gives us the opportunity to look deep into the ways that patients are interacting with their healthcare providers and how we can try to surface patterns in those communications. And so we took a look at the better part of 750 million different data points across 80 million plus patient interactions to try to get a better understanding of how patients are interfacing with technology and how that can be used to maximize those interactions. So our goal here, like I said, was to surface the patterns and behaviors that allow healthcare systems to maximize their outreach and deliver the most value to their patient populations. And we're really excited to talk about some of the findings that we came across.
Yeah, thank you, Jacob, and really excited to that process that really allowed us to go through it. And so let's dive a little bit into some of the findings we had, and based on kind of the process that Jacob outlined here, Lauren, can you jump into what are some of the cool things you find, what patients actually want?
Sure. So I guess just to start off again in the context of outreach, patients like knowing what they are getting themselves into when it comes to healthcare. So if you're going to send a message to a patient, make sure it's effective. It is absolutely, admittedly, a little weird sometimes to receive a message from a number you don't recognize. Why do they know my name, et cetera, et cetera? At least that's just me. But we found that patients are a lot more receptive and responsive to messages that actually give them enough context about, one, why are they receiving this message? And two, why should they then take further action, and time out of their day to actually do something about it? So, for example, patients are 3 times more likely to schedule a referral when the message contains the name of the provider that referred them. It's establishing, the relationship that's already there and saying oh, yeah, I'm aware of what the context of this message is. I'm aware of the person who initiated this. And same thing with scheduling preventative care. If you're going to follow up with a patient and say, hey, every year, hey, it's time to schedule your annual preventative care. It's time to come in for your annual. It's good to give them some context about why they should do that in the first place.
This is interesting.
Yeah, no, go.
Sorry. Okay, no, go ahead, Lauren, because what is interesting is that balance is going to be really important to manage, right? Now it's almost an art of how do I keep my messages short, all while giving as much context as I want for the patient, right?
Yeah.
And did you kind of see some creative, just creating messages across kind of your analysis here? And it's like things are popping up in my head when I'm looking at these data points.
No, absolutely. It is an art, and I think that's really a large part of like what we do, and I imagine that's a large part of what everyone in the communication space does. We did look at how long a message could be until you start to get a lot of drop off regarding patient engagement. And we found that if you keep your messages shorter than 400 characters, again, you want to give them information, but not like too much information because eyes kind of glaze over a little bit when you're inundated with that many messages. So if you keep it short, but keep it to the essentials, you run less of a risk of losing their attention span. And there are so many other barriers just in the everyday world, like as you said, like so much tech, so much messaging backlog. There's the issue of language barriers, lots of reasons. So you want to keep it as short as simple as possible as well.
Cool. This is great, right? I was like, really is, short and sweet, to the point, not inundated with like, a bunch of rules of things the patient needs to do when they come in, move that later, keep your patient engaged there. So it's great, content of the message is important. It's kind of one aspect of it, but there's also like timing of it and how are you going to be saying that message. So Jacob, tell us a little bit more about kind of like what we've seen on kind of these areas.
Yeah, so it's interesting, although probably not super surprising. If you think of patients as consumers, which they really are at the end of the day, tends to be a general focus towards immediacy, towards the now, towards the as soon as possible. And we see this manifest in a couple of interesting ways. I think the first is that patients are more likely to respond to a message, a reminder message for an appointment, for example, if it's closer to the appointment itself. Patients, and I know I can see myself being in the same space as someone who is often on the receiving end of healthcare, might have a hard time visualizing what their schedule is or how busy they're going to be super far out in advance, right? So there isn't a real great gain, or there's a very marginal gain if you try to send patients a reminder too far out in advance, because they might not know 2 months out exactly what their life looks like, so they're not going to be able to either reliably confirm or cancel. So the closer you are to the appointment itself, the more likely it is a patient is going to respond. And sort of a flip to this is in terms of the ability to book appointments, especially replace appointments that you have that are far out in advance. We have found that patients that have the ability to be enrolled in a wait list to replace a future appointment will try to be seen on average like up to 3 weeks sooner than their original appointment, which I think just kind of goes to prove that patients are really concerned with the now. They're really concerned with, how can I get my healthcare as soon as possible? And I don't want to have to think super far in advance. I want my healthcare, within the space of my schedule, and I can only envision so far into the future.
Yeah, and that is really interesting because it's kind of like here in 2024, I see myself as like I have no idea what's going to happen in like 3 weeks, right? Also, it is like that immediacy of like how we're interacting as society, like everything in the now and everything. I was like, I want to be able to like do last minute changes because things pop up, but flexibility of my schedule it's just starting to become more and more important, right? In that ability to rebook here. And Jacob, it's interesting how that concept of being on a wait list is really impacting, right? We start sometimes see as just gonna go on the wait list. It's very unlikely that things is gonna happen. It's not gonna pop up, but it really feels like from our analysis here that you feel like it is worth even if it's a marginal chance of like getting an appointment sooner, especially for some providers that may be booked fully in advance, that you can get that.
Yeah, definitely. And this seems to be more true, especially when you look at specialty clinics, for example, or very specific kinds of healthcare where the availabilities are sparse and you might not have an availability until 6-9 months from now. Patients, I think, pretty aggressively clamor for the chance to get something sooner, get something more immediate. And we see a lot of benefit and a lot of positive feedback in the ability to get something as soon as possible.
Well, cool. Well, thank you, Jacob. And I think we've talked a lot about what patient wants, right? How they behave, right? But let's look at the other side of the coin, right? What do they not want? What they don't really care about? Where it may be wasted efforts, or even like having actually negative impact on bridging that patient disconnect. Lauren, do you want to kind of give us a little bit of context about, it was like, what do they not want?
Yeah, no, that's super fair. I think a lot of people who work in data can empathize with this. We've probably found as much information, if not more, on what doesn't really matter with the patient as opposed to what they do actually care about. But building on the previous two kind of like categories that we've discussed, there are certain clearer lines around what works with patients and what really doesn't. So for example, a ton of folks in the patient communication space, there's a lot of research around, what's the magic number around how many reminders should you send to a patient? Somehow we've all generally converged on the number 3. 3 really is the magic number. You don't want to send any more than that. It produces too much digital noise for folks. And, if they don't respond after the 3rd, really unlikely that a 4th or a 5th is going to be the one to do it. In patient populations that are really on top of their care, for example, like they're really involved in the healthcare system, appointments are a regular part of their life, we actually found that really only 1 or 2 are super necessary. They like being on top of their care. They don't need a lot of reminders to know exactly where they need to be when. But in other patient populations where access to care is historically a little bit more difficult, they don't get a lot of care regularly, that's when that 3rd reminder is extra helpful in helping you see that that confirmation or that cancellation from them. So there's that one, but there's also, to reiterate the importance of keeping messages relevant. As Jacob said, naturally there's a lot of low engagement if you send out a message too far in advance. Same as what you said, I sometimes barely know what I'm doing next week, let alone in about 3 months. So keeping the timing relevant, always super important. And finally, we found that patients don't really love it when you message them over a weekend. No one wants to be bothered on their Saturday, which is super, super fair. So we try to avoid sending messages over the weekends. We wait until the work week starts on the weekday, and that is when we start seeing quite a lot of engagement again with our patients.
Cool. Yeah, it's cool to like really see these two facets, right? And balancing that. And it's interesting because right now I was like, okay, it was like we've been talking a lot about like this is what the data says, this is the analysis that we've run our models, and we've seen kind of these patterns. But until like we can take action, right? And it's kind of like it's more like, okay, cool. And like, all right, academic, like, yeah, nice, interesting, right? Can write a paper and speak on stages, but it's like, how do we operationalize these concepts, right? And I think it's a great way for kind of us to wrap up this conversation here. And Jacob can bring us back home. And I was like, okay, based on all of this, what are some of the tips for success? What are the things that like I can take from this, from all these brains that I have, and kind of operationalize these concepts in my own healthcare organization?
Yeah, totally. Yeah, so we distilled our findings into 3 sort of high-level tips for success. The first is ask patients for their preferences. We've seen quite a few clinics who, at least when at the start, would prioritize something like calling over voice or leaving voicemails, and they would find that their ability to engage with their patients suffered pretty heavily for it. And then after switching to a text-first communication preference, which is pretty by far the most popular and the most successful route for most patient populations, their patients now have a better experience, and they now have the option to schedule online in many cases. And then for those who do still want to call or want to rely on go to standard voice, the wait times for those clinic staff are much shorter. And kind of segueing into that, we also, we find that it's important to keep busy patients in mind. We find this is particularly salient for our customers who are or clinics who serve very large patient populations or very large clinics. And everyone has different schedules. So the more options that you can provide will improve how many patients you can reach. We have a quote from the CIO at Ryan Health, Farooq Ajmal, who said, it's not feasible to ask patients to wait until 8 a.m. the next day to call in for an appointment. It's important to give patients 24/7 access. Some patients, for more extreme cases, they might want to change their appointment or book appointment on something like 2 a.m. on a weekend. So if you're serving a very busy patient population, it's important to remember them and to prioritize them. And finally, it's important to provide next steps directly and not make patients jump through a lot of hoops. The more consolidated your ability to deliver information to patients is, the more success they're going to have in their ability to receive healthcare. So, eliminate extra steps. Don't make them log in to change an appointment whenever possible. That sort of thing.
Yeah.
Yeah, kind of piggybacking on that last point, we have found that basically, if you give the patients the opportunity to reschedule an appointment via text message, for example, they're 1/3 more likely to book it than if they had to go through a browser, open up, Chrome or Safari and go log in through a form. The fewer steps, the fewer hoops that a patient has to jump through to get to their end goal, the more success they're going to see, and you're going to see as a result.
Yeah, and this is great, and I think we've seen time and time again examples across our customer base where they have seen success. You've talked about Ryan Health in New York, but there's also Houston ENT, which is in Houston, who realized patients weren't responding to automated scheduled calls, and they went and they asked patient for feedback, and patients weren't able to pick up the phone during the workday, and they completely switched everything to SMS first communication based on that number one point of asking patient for their preference. And now the patients have a better experience. And in addition to that, given that SMS first, there is the next steps directly embedded into them, and kind of like leads to a better scheduling experience and rescheduling experience. So, Lauren, based on all of this, the data, the analysis, and kind of steps and the actions we can take, what are your kind of thoughts to kind of wrap this up in a nice bow tie?
I mean, that right there is truly the epitome of two birds, one stone, right? What's best for your staff in this case is also going to be what's best for your patients. Like, staff, obviously, they want their patients to have a better experience. They want patients to actually come in for their care, but it sucks having to constantly try to flag them down. You're playing phone tag with each other. The office is only open at certain times. Patients are only available at certain times. So this is really what we're aiming to do, right? We want whatever's best for the staff is also going to be best for the patients. And that is just solving just a tiny little bit of healthcare.
I couldn't have concluded better. This is it. This was like, our little conversation about data. Jacob, Lauren, thank you so much for joining us and giving time from your busy day, coming to inform us of how we can all become better provider, better patients, better hospital groups, better health systems, using all the data that has been collected over the year. So here it is. This is the end of this episode of Digital Health on Air. Thank you so much for joining, and until next time, to our next session. You all take care and have a good day.